Hey everyone, I'm Steph George. I'm a licensed massage therapist and I practice in Portland, Oregon. I plan for this to be my last video in a series for upper back pain. Who knows, I may come at you with another one at some point, but for now I think this is going to be it. I talked a lot about the pecs in my videos and how with those being tight, it can really affect the upper back. Those are just one internal rotator of the shoulders. And I did not want to neglect subscapularis, which is very important. It's part of your rotator cuff. And it is, if you find the outside edge of your scapula, which is right here, kind of comes up into this crease right here, and then you can follow it down. And then it kind of starts to round a little bit, and that's the bottom edge right there. So subscapularis, as the name would suggest, sub beneath, scapularis, the scapula. So it is tucked back behind there.
Here is a 3D graphic of the subscapularis anatomy. Look how the muscle is in between the scapula and the rib cage. And here you can see even more closely that it attaches to the anterior surface of the scapula, anterior meaning closer to the front of the body, and also to the humerus or the long arm bone.
The tricky part about the subscapularis muscle is that because it's tucked back there, it's not very accessible, which is very annoying. And if you try to just dig your fingers in there yourself, it's probably going to be really fatiguing for your fingers and you're probably not going to get very far with it. So I actually found a product on the market that is geared towards psoas release, which are hip flexors. That's going to be all in our next series, so stay tuned for that. So this you would lay on to release the hip flexors, and I will show you this in the next series, which I'm going to do for low back pain. But for now, this is actually the best thing that I have found for subscapularis release. And this is such an important muscle. If you've never had it worked on before, there's a good chance that if you feel it, you will know how much it needs work because it can just be so tight, and most massage therapists don't even go there. So you're basically just gonna put this down, and then you want to align that outer edge of the scapula, and you're going to be going to sink into the tissue that is back behind there. So I'm going to use the inside one of these. We don't need the other one. And then I'm going to stretch my arm out and just again find that edge and then just sink to the other side of it anteriorly, so towards the front of the body. And you don't want to be too aggressive with this. Again, this is probably a muscle that you may have never had worked before. By the way, I am happy to work this on you when you come in. But in the meantime, for self-care, if you're not able to come in or if you want to try doing this on your own, this is a great substitute. So I'm just waiting for some release. And I'm kind of thinking about pulling the tool into the muscle. You might just need to kind of fiddle with this and be patient. You might feel like, oh, that's not really getting it. But then if you make some little micro movements, you might say, oh, wow, yeah, I am getting it there. And you will know. You will absolutely know. And then if you feel like you've got a little bit of release, I started pretty high up. So I'm going to take the pressure off and then just move this down the littlest bit. Again, find the edge and then just sink in anteriorly from there. And just wait and hold and breathe. This is likely going to be pretty gnarly in here, so expect some super sticky, tight tissue, but I'm sure it desperately needs it. Most people really, really need to have this worked.
As you do this, be careful to not dig into your armpit. So you don't want to come too far forward with the tool. I want you to visualize pushing the edge of the tool
back into the anterior surface of the scapula. So you are connecting directly with the appropriate muscle. And then you might even be able to get one more, but I'm just going to keep it at that for now. So this product is called the Psorite, marketed for the psoas, and you can easily find that online. I think it's like 25, 30 bucks. Definitely worth the money. All right. Thanks so much for watching. That's going to be the last in the series, like I said, I think. Please like and share this video. I would really appreciate it. And if you are interested in checking out my website, getting more info, and even booking an appointment, that is stephgeorgelmt.com. Thanks so much. Have a fantastic day.